Good afternoon, everybody. This is David Baiada, the CEO here at Baiada Home Healthcare, and I'm joined by Nora Triola, our Chief Clinical Officer. Today is Friday, June 25th, and this is your weekly COVID-19 update. One of the things that's increasingly blurry is the reality that we are taking care of people in their home. And so then by definition, which comes first? Is it a healthcare setting where healthcare is being delivered, complex procedures or other types of engagement with patients and clients and families? Or is it a house? Or is it both? And how do we then use that judgment to make decisions on things like protocol and PPE and safety? Because that blurry line often changes the perception of what's important and why. And I think today's conversation is really about continuously reminding ourselves that the home in our context is a healthcare setting. Nora, you want to talk some more about that?
Oh, absolutely, David. And it's a pleasure to join you again today when we talk about where we've come in this journey of COVID-19. I think we have always wanted to make sure that you as our healthcare workers were maximally protected from getting the disease or transmitting the disease. And it often gets kind of confusing, I'm sure, when you're out in the community going from care setting to care setting, and you're seeing the world open up, and you're seeing fewer and fewer masks, and you're thinking, gee, here I am, and we're back in the second summer, and I've got to wear a mask and eye protection. And then you look at some of your colleagues in hospitals or skilled facilities, and they may be following different procedures, and you say again, gee, I'm wearing a mask and a face shield. Why do I still need to wear all this? And I'm here to remind you that we certainly understand the question. The question is a real question, and unfortunately, the answer is the same as it was back when we started. It's to keep you protected. The client home is where we interact with our clients and their family, where we're really providing close proximity to that client, providing direct care, procedures, things that put us in their personal space and reinforce the need for us to be maximally protected. We also know that the healthcare setting is an important setting, because in our homes, the client homes, we're caring for those clients that are high risk and vulnerable, and we would never want to introduce any COVID-19 virus into that family setting or that client. And we are often looked upon as those individuals that people follow what we do. And so we are held to a higher standard. So, when we look at the front door of a home and we open that screen door and we get ready to go in the house, it looks like any other house, but it's our healthcare setting. And it doesn't have some of the controls of ventilation, and it doesn't have the negative pressure. And it's you and that client in a very confined space, doing things around vulnerable clients who have trachs and vents and aerosol generating procedures and personal care needs that we want to make sure that you, as our precious employees, are kept safe. And so we're asking you please to understand the difference between the two, and keep your masks up and keep your eye protection on, because that virus looks to go into your eyes, nose, and mouth. So hopefully that reassurance, as soon as we can take it off, we'll let you know. But right now we need to we need to follow that. And I think this is a perfect expression of gratitude. This is Megan from our Linwood Visits Office, and she's a speech language pathologist who certainly knows about that personal space and about checking individuals for any kind of vocal paralysis or speech issue, and has to get close and personal with our clients. And so wearing that protection is important. And she says COVID-19 has helped stretch out our normal therapy box and come up with new and effective ways to help our clients. For sure, that's what she's doing. And we know that all our speech language pathologists are doing it, and our clinicians across the organization are really showing up in different ways to care for clients. And we appreciate everything you're doing, and want to say thank you and express our gratitude, and know that the world sees home care in a whole different way now through COVID-19, and it's because of your efforts. So we're grateful. We appreciate it. Keep up the good work, and we'll be back next week.
Thanks, Nora. I want to echo those sentiments. Keep up the great work, one day at a time. You're all doing a great job out there, and we appreciate everything you're doing. We'll see you next week.